We started with the emergency meeting presided over by President Park Geun-hye in Korea on Middle East Respiratory Syndrome, or MERS, which has caused 2 deaths already here in Korea. Let's connect to our Connie Kim at the news center. Connie, could you tell us more about what was discussed at the meeting?
Well, Daniel, at the meeting attended by ministers and doctors, President Park called for containment measures and other ways of dealing with the outbreak.
그 환자의 치료와 또 그 처리 과정 및 감염 경로, 그다음에 치료 의사들의 그 어떤 이동 방향 이런 것에 대해서 좀 그 논의를 해야 되겠고, 또 그 이후에 그 접촉 환자의 그 진료 기관 또 진료 의사 등 그 환자들의 그 이동 경로가 어떻게 됐는가 하는 것을 이제 파악해 볼 필요가 있겠습니다.
There, President Park emphasized the need to prevent the further spread of the disease, including keeping track of people traveling in and out of MERS-infected countries, as well as ways to completely isolate MERS-infected patients from the general public. She vowed to create a team of health experts to devise measures to protect children and the elderly, the latter of which are more prone to the viral disease. And Daniel, this just coming in, the government has decided to create a controls tower to prevent the spread of the virus.
Okay, well, the numbers are staggering, Connie. 30 MERS cases have been confirmed so far. That figure could apparently rise quickly. Hundreds more are suspected of having contracted that virus. Could you give us more details on that?
Well, Daniel, Korea's health ministry says a total of 398 people are suspected of having contracted the disease, and 99 of them are currently being tested. Now, 5 new MERS cases were confirmed today. 4 of the 5 were in the same hospital ward as the first patient. One tertiary infection was confirmed in a 60-year-old man who shared the same hospital room with a patient whose case was confirmed earlier. And some unsettling news: 3 patients are reported to be in critical condition. However, 3 other confirmed MERS patients are set to be released from the hospital. Now, also, the person with MERS who traveled to Hong Kong has tested negative and is reported to be in stable condition. Now, currently, more than 1,300 people had direct contact with MERS patients, are isolated in their homes or in quarantine facilities to prevent the disease from spreading.
Well, it must be a nerve-wracking moment for them at the moment, but they do have a big and important role to play. Let's hope they listen to the authorities and stay home. Connie, how are the health officials viewing today's confirmation of another tertiary infection?
Daniel, health officials say there will not be indiscriminate tertiary transmission of the virus because all tertiary infections have come from the hospitals where patients infected with the virus were being treated. Take a listen to what one expert had to say.
Hospitals that are treating MERS patients prevent other people from entering those wards. Places other than these hospitals are virus-free.
Kim said, however, people should refrain from visiting someone who was diagnosed with MERS even if they are in recovery. Now, another concerning issue as the number of confirmed MERS cases rises is that the country is running out of treatment facilities for new people infected with the virus. The 17 designated hospitals authorized to treat MERS patients have special containment wards capable of blocking the virus's spread. But these wards have a total of just 105 beds. Meanwhile, Korea is adding to its list of preventive measures. Reservists who have traveled to the Middle East or have had contact with a MERS patient will be allowed to delay their mandatory military training. And as another preventive measure, Korea has decided to temporarily close more than 200 schools, though officials say it's highly unlikely that young people will contract the virus if they avoid going near the hospital and wash their hands frequently. Now this week will be critical because the 14-day incubation period from the first person who contracted the virus is now up, so we'll have to continue to monitor the disease's progress here in Korea. Back to you.